We're going to start off by hearing from Larry Merlo, President and CEO of CVS Health. And as I just found out, a fellow Pittsburgher and fellow Steelers fan, a company that touches more than 100 million people each year through its retail locations, walk-in clinics, pharmacy benefit plans, and Medicare offerings. Larry has pioneered an innovative approach to making care more affordable, accessible, and seamless. Under his leadership, the company has made several bold public health moves, including, as you may remember, becoming the first major retail pharmacy to ban tobacco sales in 2014. Larry has also led CVS Health through several successful acquisitions, including its recent merger with Aetna. Please join me in welcoming Larry Merlo. And here to sit down with Larry is Brian Kelly, Editorial Director and Executive Vice President at U.S. News. Brian Kelly, everyone.
Thank you, Kim. Larry, hi. Pleasure to have you here with us. Before we get started, I just want to establish your street cred. Larry's the CEO of the largest healthcare company of America, or close to it, but started as a pharmacist, which I find fascinating, in the Washington, D.C. area. What was your trajectory here?
I graduated from pharmacy school, headed to D.C., and how many people remember People's Drug Store? Okay, we got several hands, and not too far from here, over in Georgetown, was one of the stores. And Brian, what's interesting is, that was more than 40 years ago, so I'm dating myself, but the role of the pharmacist in terms of being, part of the community and getting to, know the customers, the patients, their families, that trusted resource, that hasn't changed. And it really has shaped my views in terms of, how healthcare has evolved and some of the challenges that we have today. And the role that the pharmacist plays in terms of, helping people. And I could remember, many of my customers looking for advice. And oftentimes, have you talked to your doctor about this? And they'd say, no, should I? And oftentimes you would say, yes, you should. And every now and then someone would say, would you call them for me? Because you'll understand it better than I do.
Ironically, I was a student at Georgetown shortly before you got there, and I remember I bought my plastic Christmas tree and a lot of Tylenol at that CVS. And my question now, fast forwarding, because the CVS down the end of my street in Chevy Chase is a fabulous location, but how come they always run out of the Merry Bright Christmas lights just when I put my tree up?
Multi or white?
It's the white LEDs.
Okay.
It's always, I'm a little late, I will admit, but it's I think we got a supply chain issue that you want to address there. We at U.S. News, as Kim mentioned, we take a small amount of credit for the gigantic merger between Aetna and CVS. On this stage 2 years ago, I interviewed Mark Bertolini, and he and Larry had put something together that he was fairly new in concept at the time, and he laid out what it was you were going to do. And a year ago next week, I think, you finally closed the deal, a remarkable deal. And I will fast forward, and last week you had some pretty good earnings results, so in short order, this has come together in a significant way. But take us back through that. A year ago, you're sitting here, you're buying a $69 billion company, and you're hoping to change the healthcare industry. What was going through your mind then, and where'd we get to today?
Well, Brian, you don't look at the zeros at that point, and it's heads down. But look, we all see the challenges that we have in healthcare. It's become too costly for many. We've got a healthcare system that is difficult to access and navigate, and at the same time, we're not achieving the best health outcomes. We've got 2/3 of the country that have one or more chronic diseases, and we can and we need to do better. And the combination of Aetna and CVS coming together, we really think about three imperatives that bring this to life. The need for healthcare to be local and meet people where they are, whether it's in the community, in their home, or for many now, the palm of their hand. The opportunity to make it simpler and to help consumers of healthcare access the information, the resources that they need to make informed decisions. And our North Star really is helping people achieve their best health, and in doing so, reduce overall healthcare costs. And Brian, when I say that, sometimes people say, Larry, it sounds like you talk about, the growth of chronic disease. It sounds like you're going to cure diabetes. And I'm sitting here saying, no, we're not going to cure diabetes, but how many patients, consumers do we have, across the country that are not following their care plan? And as a result, they're weeks, months away from, episodic unintended medical events that, number one, can be debilitating, number two, are certainly adding costs. That's what we need to focus on, and we believe that this combination can do just that.
So you're pushing forward with that. You have had Minute Clinics for a number of years. That's expanding. And then just this past year, you began the Health Hub concept. What's the difference between those two?
Well, the Minute Clinic story, Brian, I'll share some stats, because when Minute Clinic first opened, our tagline was, you're sick, we're quick. Now, what's missing from that is the quality aspect of healthcare, okay? We all get that, all right? Which, it does tell us what we've learned along the way, and we've now seen almost 48 million patient visits. The statistics here are pretty interesting. Half of the patient visits occur nights and weekends, and half of the patients that we see do not have a primary care physician. And, what we've learned over the years is while Minute Clinic was born out of, acute, care, acute illness, we have been migrating, to, it's not just about acute illness, it's about the management of chronic disease. Some of the things, we were talking about, a minute ago. And, what we have found is that we can provide, through the nurse practitioner, high quality care, with, the cost associated with that site of care being an important variable when you look at, care delivery in the right care setting. So a lot of learnings over the years, and by the way, it also gives us the confidence in terms of the role that we can play as a complement, to the role of the primary care physician. So now fast forward to, the health hubs. We opened our first stores, in Houston, Texas. If you turned around and said, why Texas? When you go for permits and approvals, you can pretty much do anything in Texas, okay, in pretty short order, okay? And so, we got the first hubs up and operating in the February timeframe. So we've got, got about 8 months. And, think about, the evolution of, Brian, you're talking about getting your Christmas lights. Think about this as the evolution of the corner drugstore. And I could remember, back to Brian's first question, that store in Georgetown had a soda fountain, okay? And, the evolution of the corner drugstore went from the soda fountain to a convenience store, and, we see ourselves leading the evolution of the corner drugstore to more of a health destination. So think about 20% of that, we call it front of store, being repurposed for health-related products and services. So that Minute Clinic, has expanded capabilities. We're doing in-clinic phlebotomy, and we can treat about 80% of what a primary care physician could, treat in his or her office, in those Minute Clinics. We have additional services that focus not just on sick care, but on wellness. And one of the things that we've gotten tremendous learnings is, we put a position in the store that we're calling a care concierge. We weren't sure what we were going to learn, okay, but the objective was, what is it that our customers are going to be looking for? And Brian, the learnings from that have been unbelievable. That it has covered the gamut from my physician said to do this, and I'm not sure how to get started. So we're triaging that person to the right person to get the right information to get started. It may be a product, it may be a service, to, I have these health benefits, I don't know how to use them. So there is a tremendous amount of learning that we're getting. And from from our vantage point, it just speaks to the silos that exist across the healthcare supply chain and the opportunity that we have to break those down. So, overall, it's validating our beliefs in the strategy. We're now moving into 3 more markets by the end of this year, Philadelphia, Tampa, and Atlanta, and we announced plans to have 1,500 health hubs across the country by the end of 2021.
These are physically larger than a normal CVS, or
No, Brian, they're the same. They're the same size,
right.
and we've taken out. I don't know if you'll get your white sets, Brian. I should break that news to you now, but we've taken about 3,000 products out of the store, and the front of store continues to have a focus on health, beauty, personal care, and some elements of convenience. You may not have the same amount of space for greeting cards, but you can still buy a birthday card there. And again, the feedback that we've gotten in Houston has been terrific.
It's interesting. So one of the things that we talk about in terms of communities, understanding communities and the whole issue of population health, social determinants of health. And we work with the Aetna folks on the healthiest communities that you're aware of, ranking all the counties. We would love to get deeper and deeper into data. How does that play into what you're doing on a community level basis? You have 10,000 CVS outlets.
Yeah, and look, we're in communities all across the country, and today about 70% of the U.S. population lives within 3 miles of one of our pharmacies. So, Brian, look, we love the partnership in terms of understanding the issues facing communities, and we've done things over the years. Through our philanthropic arm in terms of, we call them Project Health events, where, we've gone into, underserved communities and, provided free screenings. The statistics that we see are very alarming. We've probably treated about 2 million, customers, patients, over that period of time. And, you hear statistics that 30% of the people that we saw were walking around undiagnosed, with some, chronic condition. And, one of the things, Brian, that I think this combination, there's such a huge opportunity, and we're calling it developing our destination health platform, because you think about the accessibility that we have. There is trust in, the CVS Pharmacy brand, and, how we can, through partnerships, connect some of the unmet needs that exist. You think about the fact that, a member of our team, shared with me, Larry, think about this, that over the course of the year, we're awake about 6,000 hours. And how many of those hours are spent on healthcare in the physician's office? Not many. How many of those hours are spent in our communities? Most. And, we've begun to do some partnerships down in Louisiana. We have a partnership with an organization called Unite Us, where, they have, access to, things like, fresh foods and, other transportation needs. And, I think there's a lot more that we're going to be doing in that area to, help. It's almost like we're a convener, okay, or playing quarterback to meet, the needs of, of folks, in those areas.
Yeah. So a lot of hospital executives in this audience. And as an industry, they have their own set of issues. But we look at you and we look at Amazon with some of their initiatives, Walmart. Do you see yourself as a competitor, a partner? How does this work going forward?
Yeah, Brian, look, it's a great question. And, as you look at consolidation across, many industries, a lot of, I'll say healthcare, sectors, the large-scale acquisition activity is probably behind us. If you look at the retail pharmacy industry as just one example, you've got, CVS, you've got Walgreens, and, you've got Rite Aid, and then the 4th largest drug chain is 100 stores. So, the lines are beginning to blur in terms of, being competitors and being, business partners. And I think that, that's important. I mentioned earlier, Brian, that, we don't see replacing the role of the primary care physician. But I'll go back to that, to that individual that, that has diabetes. If they're going to their physician on a quarterly basis, they're leaving the office with a care plan. That care plan, has instructions for diet, nutrition, exercise, medication, and some, regularity around blood testing. But who knows if that care plan is being followed? And Brian, those are some of the things that we're learning and seeing. And some of this is anecdotal, but we had an individual that visited one of the hubs in Houston. She was diagnosed with diabetes 2 years ago, had not been back to the physician. She was complaining about some symptoms, and the nurse practitioner, checked her A1C level. It was 12. 12. So, there was some care provided on site, called the physician, got her in to see the physician, and, he acknowledged she was within, weeks or a few months of an unintended medical event. So, you think about, what we're doing with this combination. There's a tremendous amount of information, about, the Aetna members that, that are being served. But you think about the role of the insurer. How do they activate that? How do they operationalize that information? They pick up the phone, they send a letter, and we know the success rate associated with that is pretty small. That phone call at 8 o'clock at night, who's this again? A faceless name. So, you think about, Aetna has a tremendous amount of content, and, CVS has the community, the customer-facing assets with trusted resources. So now you think about how we can combine, that next best action, that can result in a higher form of engagement, and hopefully, behavior change in terms of doing something that's going to help that individual achieve their best health. Those are all the things that we're after.
Yeah. So 2 issues on that community health front that you guys have been very involved in. Tobacco. 5 years ago, you made a big push, very costly push, I understand, to get tobacco out of your stores, and opioids, which is an ongoing issue. How has the tobacco thing worked out in a good way for you, even though it's still a problem? And what are you doing about opioids?
Yeah, Brian, it has. Listen, I remember, we celebrated 5 years in September. We went from making that decision. And by the way, one of the things that we did is we rebranded the company from CVS Caremark to CVS Health with a new purpose. And that purpose is 8 words: helping people on their path to better health. And that purpose really energized, our colleagues, because first of all, it's 8 simple words, and everybody could internalize, what it meant. And over the last 5 years, I'm very proud of, our colleagues in terms of things that they have done, big and small. The person that's responsible for purchasing suntan lotion as an example, this wasn't, an idea from the top of the house. She came forward and said, look, this is my category. I'm looking at the clinical literature. We sell suntan lotions with an SPF of 4 or 8, and the literature is saying, you need 15 and probably 30. I think we should stop selling these products because it's creating a false positive for individuals. And we did that. So there are a number of things that have happened, as a result. And look, I could remember probably with, some of you here in this room as we were, on our journey to become more of a health services company and, looking to forge partnerships. I'd be in some of those meetings, would be, 2/3 of the way through the conversation, and someone would bring up the fact that we sold tobacco, and it really compromised what we were trying to do. So we made the decision. Brian, as we look back, it was absolutely the right decision. It opened doors. We've been able to grow both organically and inorganically. And, equally important, I remember that first year, there were 95 million fewer packs of tobacco products sold across the country. There was a direct correlation between CVS market share and the rate of sale. And, at the same time, we introduced cessation programs to help people quit. We know it takes on average 7 times before someone's successful. And in working with community partners like Tobacco Free Kids, the Truth Initiative, Cancer Society, we launched a campaign to create the first tobacco-free generation. And We had a focus on college and university campuses. I'm pleased to say that there are 200 college campuses that today are tobacco-free that weren't a few years ago. Now, we've taken a step back with vaping, and we're beginning to get more involved in that, and that's something that is alarming, should be alarming to all of us when we look at, I saw the stats in 2018, there's 3.6 million middle and high school students that are vaping. And I saw another stat that 78% of them will begin to use tobacco products before they finish high school. So, and we're doing some things to get the dangers of vaping into every school curriculum in the country. Look on opioids, another epidemic, and we've been working on a number of things that you think about the role that our pharmacists play in terms of dispensing opioids as a result of prescription from a licensed prescriber for a legitimate medical need. And we've worked with pharmacists with technology and analytics to help pharmacists identify when that might not be the case, and what to do as a result. But we've also done things like drug take-back programs, and this was eye-opening for all of us. We started in working with local law enforcement, police departments, to put disposal units where we'll remove the products in a safe way, and then we extended it into our stores. So between police departments and our stores, we probably have close to 3,000 of these units. And over the last several years, we have removed over 1 million pounds of unused medications from medicine cabinets across the country. Now, I want to be clear, these are not all opioids. But it was eye-opening in terms of, look, we can empty every medicine cabinet. By the time we're done, it'll be time to start over again, because we haven't gotten to the root cause of why this is the case to begin with. So that led us to work with insurers and providers in terms of a first-time user of an opioid, we're not going to dispense more than a 7-day supply, because I think we can all relate or know someone that went to the dentist, had a procedure, had some acute injury, and walk away with a prescription for 30, 60, 90 hydrocodone or OxyContin. That's what's creating this problem. And by the way, we have seen almost an 80% reduction in the number of prescriptions that we've dispensed for more than a 7-day supply.
Great. Well, I'm afraid we're going to have to leave it there. We've covered about $100 billion worth of your $200 billion business. You guys really are a force of nature. We are absolutely fascinated to see the evolution of the company, and hope you'll come back and tell us a little bit more about it this time, maybe next year, and presumably fix the Christmas light problem between now and then. So,
happy to do that, Brian.
Thank you, Larry.
Thank you.